Hello and welcome to Health Matters on Channels Television. Thank you for joining us. I am Mary Alale Yusuf. In 2020, there were about 241 million cases of malaria worldwide and approximately 627,000 malaria deaths. Most of these were in the WHO Africa region, which in 2020 shouldered 95% of the global malaria burden and 96% of the deaths. Children under 5 accounted for about 80% of all malaria deaths in the region. Since October 2021, WHO also recommends broad use of the RTSS malaria vaccine among children living in regions with moderate to high P. falciparum malaria transmission. The vaccine has been shown to significantly reduce malaria and deadly severe malaria among young children. Malaria is a life-threatening disease caused by parasites that are transmitted to people through the bites of infected female Anopheles mosquitoes. It is preventable and curable. My guest was Chairman, National World Malaria Day Committee 2019 and is Executive Secretary, Nigeria Universal Health Coverage Actions Network, Dr. Uzodimma Idiri-Eje. You're welcome to the show, sir.
Thank you, Mary. My pleasure being here.
Now, harness innovation to reduce the malaria disease burden and save lives is the theme for this year's World Malaria Day celebration. So my first question is it a matter of looking for new innovative tools to fight malaria or using what we already have properly?
It is a matter of both. We have to be innovative. First, innovative in devising very new approaches of taming the malaria scourge. We also have to rely on what we already know and what we are already doing to make them better, to improve on them, and ensure that they deliver on what they're supposed to deliver. This principally is where we have not done well, not satisfactorily.
WHO says while the milestones and targets remain the same, the approaches to tackling the disease in some areas have evolved to keep pace with the changing malaria landscape. Do we need to adjust our methods in Nigeria?
What we need to do in Nigeria is not to adjust the methods for controlling malaria because they are already proven, but to embrace them, emphasize them, drive them with policy and action and budgeting and commitment, and make them people-focused consistently at all levels, at all times.
Okay, in October 2021, WHO said RTSS is good, it's been proved, it saves lives, you can roll out. The pilot scheme proved that it was good. It prevented deadly malaria in children in Kenya, Malawi, Ghana. How is that going now? Have they rolled out, and what are the results?
Countries presently are rolling out. Some countries are rolling out, but Nigeria has not rolled out. But in countries that have rolled out, the results have been satisfactory, not obviously in line with what the initial experimentations brought up. So it is something that has to be embraced, both through policy-wise and by implementation. And at the same time, monitoring and evaluating and ensuring that evidence is generated and utilized to improve the system.
How soon do you see Nigeria rolling out the RTSS?
In all honesty, I expect that Nigeria will roll out immediately. And we look forward to that happening. But when exactly that is going to happen, I don't have it on my piece here now. I think it will become a public knowledge whenever the country rolls out. But I expect and urge that it should be immediate.
We've been told that every human being has a residue of malaria in their body, and all they need to do is be stressed a little bit, and it comes up and becomes a full-blown malaria infection. Do you expect to see that changing? How does all this medication and, vaccine, how does that change anything? How will the vaccine even be effective if somebody already has the malaria parasite within them, even from birth?
Okay. Now, all right. Now, it will work out. What the vaccine will do is to reduce drastically the tendency for Plasmodium parasite to develop into full-blown malaria. So that is very possible. However, it has to be emphasized that malaria control is not all about drug intervention and then vaccine. In terms of drug intervention, there are several things that have to be done. The first thing is that our people need to be environmentally sensitive to stay in environments that do not promote the Plasmodium parasite from growing, from multiplying, from incubating. The second one is that we also have to be very conscious of the feeling we are having. Everybody who thinks he or she has malaria should not, is advised not to commence any treatment without a full-blown malaria test confirming so. Good enough, there are rapid diagnostic kits that can be used to do this. It is only after a test, a properly done test has confirmed malaria, that treatment should commence. And when treatment has commenced, treatment has to be completed. The full dose has to be taken up. If you start malaria treatment, chances are that in the first 24 hours of 3 days, the symptoms would have gone and you begin to feel that you're well. No, you have to complete the full dose of the malaria treatment. And you also know that we can also embark on preventive measures. There is intermittent prevention treatment for infants. There is intermittent prevention treatment for pregnant women. And those can also be embraced so that people do not really have to wait for a full-blown malaria before they start treatment. Because a full-blown malaria also has its morbidity consequences and can result in death.
Since you have taken us down this path of, prevention and treatment, children and pregnant women, people with HIV, AIDS, people with low immunity, because they are coming from less endemic countries to more endemic countries, moving populations, are the ones who are most at risk for malaria. What are the interventions for these people? Are they different? Are they more than the other people who are actually situated in the endemic countries all their lives?
Now, within the malaria control modicum, we have what we call seasonal chemoprevention. So those who are predisposed to malaria, either because of where they are coming from or because of lowered immunity, can actually work towards taking the seasonal malaria chemoprevention chemotherapy, so that it would aid in preventing malaria from blossoming. However, that does not remove the necessity to also take other measures to prevent mosquito bite, including sleeping in insecticide-treated nets, including people who can actually use insecticides and flint their homes, including keeping our environment clean, and where necessary and possible, using a germicidal approach to on stagnant waters and places where mosquitoes breed.
What is this seasonal medication that they give to children particularly? I know that pregnant women get, some sort of tablet. Is it the same Sunday, what we used to get as children? Or is it different?
Now, the first thing is it will be wrong to start making a prescription on TV. So if anybody feels that there is something that looks like malaria symptom, please go to a clinic. When you get to the clinic, the proper test will be done. If it is malaria, you will be told it's malaria and treatment will be commenced. If it is one that is still coming, so that people do not begin to embark on unnecessary self-medication. There are several things that people come down with, and they present the same or similar symptoms as malaria, namely fever, feverishness, and so on. So people should headache. So these are some of the symptoms of malaria, but it's not only malaria that causes them. So that providing a prescription on TV would really be a bad approach, and people would need to go to clinic so that they don't say it was said on TV. And when they have stress, they begin to treat malaria.
I'm not asking you to provide a prescription, but you spoke about prophylaxis, that's preventive. Is it something they have to come to the hospital to take? Because as a child, you know, we had the preventive already with us and took it every week. I'm just asking, what's the mode now? Is it something that is prescribed or something that you already have and you take every week, every month, you know?
Now, it has to be prescribed. The reason is that self-medication isn't good on any level. And then also remember that all malaria treatment, the advised malaria treatment is artemisinin-based combination therapy. So people have to be sure that that is what they are also working on. And for you to do that, please, it's important that a duly acknowledged health practitioner is prescribing for you.
Thank you so much. I'm going to call for a break now. I'm going to call for a break now. When we come back, we'll continue with this. Please stay with us as we go on a short break. Welcome back. We're talking about malaria ahead of World Malaria Day, which may not be as harmless as you think. This is Health Matters on Channels Television. Please tweet at CTV_Mary A or send email moalale@channelstv.com. Thank you. Doctor, now WHO says that if one is infected with Plasmodium falciparum, that's the most common form of malaria-causing and most dangerous form of malaria-causing parasite, that it can be dangerous, escalate, and cause death in 24 hours. I am wondering, does that happen in Nigeria to people who have been living in Nigeria, our own endemic country, or are they talking about people who are visiting? Because the attitude towards malaria is, it's ordinary malaria, we'll treat tomorrow, you know, or take this medication. Is it that dangerous?
It is that dangerous. And honestly, it is this thing now you mentioned as the attitude that is the greatest challenge to malaria control. People think they know. People think they understand. Is it not just malaria? And yet, before the end of today, 549, about 550 Nigerians will die from malaria. And yet, before the end of this year, more than 200,000 Nigerians will die from malaria. It is Nigerians that are inside. It is not those that are coming in. The bulk of the mortalities and morbidities in malaria we have are for those who are already here, for me and the rest of us. And that is why we need to be circumspect about it. The WHO is right in its statement about the falciparum, and it is indeed the issue we are talking about. People, everybody need to pay attention to following the appropriate protocol in managing malaria. No self-medication. Don't treat without a test. And when you start treatment, please complete it. Check out your environment and keep them good and neat enough.
How easy is it to get a rapid diagnostic test? Are they available? And are they expensive?
Now, the first thing I would say here is that health is not cheap, realistically speaking. Rapid diagnostic tests would cost money, but efforts and appeals we are making is that the federal government actually should, as a matter of urgency, declare universal free access to malaria treatment in Nigeria, so that people do not get scared of the kind of cost you're thinking or talking about now, so that people are not dissuaded from seeking care because of money. Federal government, we are urging, appealing that federal government should be persuaded enough to provide universal free access to malaria tests and treatment in Nigeria, beyond the small fund that Global Fund and the rest of them are bringing, which are essentially not enough. Citizens of this country still suffer from catastrophic out-of-pocket expenditure for e-health. And the most principal, the most common, the most ubiquitous ill health in Nigeria actually is malaria. So attention should be paid to that. Government is appealed to, requested and urged to provide free access to malaria treatment, diagnosis and care for all Nigerians, so that people can access tests, access treatment, be well, and contribute to the national economy.
Okay, you have said that some of these methods are effective, but people should add more. There should be innovation into the malaria control, vector control. We already have insecticide-treated nets, indoor spraying, we have medication. What happened to genetically modified mosquitoes, for example? What happened to pyrethroid combination treated nets, the ones that they are planning to treat with pyrethroid and clofenapir? What happened to attractive targeted sugar beets that they are planning to put on the outside of houses for outside vector control? What happened to spatial repellents to spray in the air outside? What's happening to those innovations? Because those were the innovations in the pipeline. Has any come out, or have they been stalled? Because we were told that for some time now, the gains of malaria control have stalled. It looks as if the vectors are becoming used to our methods.
All right, so the first thing is, why have the gains of malaria control stalled in the past few years? The most obvious thing is that the COVID season adversely affected every aspect of health, both in care-seeking behavior, both in those who provide the services. If you check back, the year before the COVID came, the global death from malaria was about 624,000, was about 508 something, around 580,000 or so. But an increase of 60,000 just emerged following the COVID period. So we need to know that there are other issues that are emerging and can emerge and cause problems in malaria control. And then for the innovations you are talking about, they are all there, and a good number of them are still undergoing stages of various trials. As soon as they are finished with and definite comments are made on them, then it will be very important to let people know about them. But for now, the essential approaches to managing malaria have been mentioned, and people are urged to follow those while awaiting the outcome of innovative interventions that are currently on trials.
Okay, I must thank you very much, Dr. Uzodinma Aderieje, for coming to the show. This has been really enlightening and fun, in spite of the fact that we are talking about something dangerous. Thank you so much for coming.
Thank you so much, Mary. It's been a pleasure being here.
Now to some other business. The Adewumi Desalu Parkinson's Foundation has been opened in Lagos. It is an entity which aims to give information about Parkinson's disease and provide support for people living with the condition. Parkinson's disease is a progressive nervous system disorder which affects movement. Let's see the report. Activities to dedicate the Adewumi Desalu Parkinson's Foundation begin with praises. The foundation is opening in memory of Dr. Adewumi Desalu, diagnosed with Parkinson's disease, who fought it for about 10 years until his death in 2019.
After university, my dad went on to have an amazing career, as I alluded to, with companies like Gulf Oil, Westinghouse, General Electric, and eventually his own company, Botag. He was an inventor, he had patents, his work is found in many areas of society.
According to a report of the World Health Organization published in 1997, the prevalence of Parkinson's is 165 in 100,000 people. But doctors say it is still grossly underreported in Africa.
I make music to your name.
Mrs. Omotola Thomas, founder of Parkinson's Africa, was diagnosed with the disease in 2016 at the age of 35. Watching her and hearing her story gives one an idea of the degenerative nature of the disease.
My journey started almost 6 years earlier in 2019 with a slight twitch in the forefinger on this hand. And over time, that twitch escalated into a full-blown tremor, and then additional symptoms started to show up. I had muscle rigidity, stiffness, weakness, pain, fatigue, apathy, depression, anxiety. It's a long list. Parkinson's disease has well over 30 symptoms. In addition to the shame and the stigma that surrounds Parkinson's disease, particularly in areas like Africa, many Africans do not have access to the education, the support, and healthcare resources that they need to live well with Parkinson's disease.
Psalm 92, what does it say?
It is for such people that the Adewumi Desalu Foundation comes as an answer. The foundation is equipped with world-class facilities to improve the lives of those with Parkinson's disease and has an ambitious list of targets in view.
The foundation will provide information and awareness about the disease. We are providing a boxing arena. We have a writing room over there where we're teaching people to write, because one of the things that Parkinson's takes away from you is writing.
A group led by Right Reverend Oluronti Odubogun, Emeritus Bishop of Ife, and Dr. Adekunle Desalu proceeds to cut the tape and unveil the plaque.
That is to the glory of God and the service of mankind.
Another thing the foundation is equipped with is a low-impact gymnasium for patients to increase levels of a chemical called dopamine, which can improve motion, mood, and decision-making. The foundation also plans to collaborate with other bodies to make medication available to patients in Nigeria and fund research. Mary Alale. A degenerative disease indeed, but it can be managed. And Health Matters is dedicated to bringing you information so that you can make informed decisions about your health. Thank you so much for watching. Have a wonderful day. I am Mary Alale Yusuf.